65 doesn't have to mean declining health, but there are 5 major health dangers that you need to be aware of. In this video, we're going to talk about what those dangers are and how you can stay healthy, strong, and independent as you age. And most importantly, how Medicare can help. Hi, I'm Erika Smiley, one of the educators here at MedicareSchool.com, and today we're taking it out of the studio and on the road to look at 5 major health dangers as you age. Now, most people think of Medicare or any health insurance as something you use or something you need when you get sick, but actually there's a lot of ways you can use your Medicare plans proactively to stay healthy and independent as you age. Health risk number 1 is falls. Now, it's reported that every year there's 36 million seniors who fall. This translates to 98,630 older adults falling each day. The CDC breaks this down even more, that says an older adult falls every second of every day. Falls are the leading cause of injury and death in older adults, and it's reported that 1 in 4 people over the age of 65 will have a fall each year. So you may say, hey, a fall is an accident. It's something that accidentally happens. How can I prevent that? Well, there's actually a lot you can do to prevent falls. And one main thing is working on your balance. Now, here's a couple of simple things you can do at home to not only test your balance, but to work on your balance. So the first one that I've seen is the test of, can you put on your socks and shoes while standing up? It's harder to do than you think. Maybe the socks, but to put on a shoe and tie a shoe while you're standing, they say to do this every day and keep doing this, and it will help you improve your balance. Now, the second thing you can do to work on your balance is just some simple exercises like standing on one foot. So just stand in balance on one foot and see how long you can hold it. So maybe aim for 30 seconds the first time you do it, and then try and increase it to 60 seconds as you get better. Do this on each foot. Now, to make it a little bit harder, you can take it up a notch, and it makes a huge difference to stand on one foot with your eyes closed. It's a lot harder than it looks. So balance on one leg with your eyes closed. When you get ready and go to the next level, you can take a pillow, put it on the floor. Same thing. Stand in balance on the pillow on one foot. This is with my eyes open. And as you get better and you want to try it, you can try to balance on the pillow with your eyes closed. And it's just going to give you an unstable surface and make it a lot harder. So that can improve your balance a lot. Now, the third exercise you can try is heel walking or toe walking. So just simply raise up off of your toes and walk across the room on your heels. This is going to strengthen your ankle muscles and help you get a little bit more flexibility. Same thing, you can go up on your tippy toes and walk through the house on your tippy toes just to strengthen your calf muscles and your ankle muscles and help with that balance. Anything you can do to improve your balance is going to help you prevent falls. Now, some other things you can do, obviously, is classes or things like yoga. So if you don't want to go to a gym or a yoga studio, you can just go online these days and just put in free yoga video or go to YouTube and look up yoga classes. So yoga or chair yoga, even Pilates can be great to help with your balance. In addition to this, another great balance builder is Tai Chi. So it's a slower rhythmic movements. I know there's some YMCAs across the country and senior citizens that actually get grants to do Tai Chi courses and classes because it can help your balance and minimize the risk of falls. Now, if you do have a fall, how will Medicare pay? Well, obviously, it's going to cover some things you may need, like an ambulance ride to an emergency room, hospital stays, going into a skilled nursing facility or a rehab center, and even physical therapy. Now, depending on the plan you have, if you have an Advantage plan, you're going to have copays for each of these things. And what your copay is going to depend on what your plan is. If you have an HMO or a PPO and what you'll pay out of pocket. If you have a supplemental plan, like a G plan or an N plan, that should pay as long as you're going to a doctor or a hospital that accepts Medicare. So again, this one's really important because how many people do you know that they fell and they just never came back from it? They broke a bone, they end up in a skilled nursing facility, and their health just declined and they were never really the same. So the biggest way to prevent this is make sure you do these simple exercises and work on your balance so you can stay safe and prevent falls. Hey, if you found this video helpful, do us a favor. Go give us a like. We always appreciate it. And subscribe so you don't miss out on any of those future videos. And leave us a comment. We'd love to hear what you have to say. We love to answer any questions you have. That's what it's here for. So drop us a comment below. Health danger number 2 is inactivity. Now, I heard this stat or this saying the other day, and I couldn't believe it. Someone actually said, sitting is the new smoking. That's right. It's crazy, but sitting and being inactive can be as bad for your health as smoking. So here's the thing. You have to stay active and keep moving as you get older. That may be walking, stretching, just getting out there and being active. But it's really important also that you pay attention to strength training. Now, strength training is important because as we age, we lose muscle mass. It's said that as you hit age 60, you start to lose 1 to 2% muscle mass per year. Now, this age-related muscle loss is called sarcopenia. So we have to make sure that we do strength training and lift weights to keep that muscle as we age. And Harvard studies have shown that after age 65, this can increase to as much as 3% muscle loss per year. So the way you like to think of it, we don't need to all be bodybuilders or going to CrossFit, but are you fit for life? Can you do the things you need to do in your everyday life? Maybe that's put a suitcase up overhead if you're traveling on an airplane, or picking up your grandkids, or simply just carrying the groceries from the car. Now, strength training, not only is it going to improve your muscle mass, but it can also help with your bone density and prevent things like osteoporosis. It's also going to help with your overall balance, which could help prevent falls. Strength training and exercise overall has also been shown to help your mental health. Have you ever been in a really horrible mood and then you go to the gym or you go on a walk and instantly you feel better? Not only this, it can also help improve your quality of sleep, and we all know how important sleep is. Now, it's also linked to helping with chronic conditions. Those who exercise and have a regular exercise schedule are going to have less hypertension, diabetes, or cardiovascular issues. And moreover, regular exercise can just help your overall health and lifespan. If you keep your strength, your flexibility, and your endurance as you age, you're going to be able to be much more independent as you grow older than you would if you're not a regular exerciser. Now, you should always talk to your physician or doctor before you start an exercise program. But if you have any problems with your joints, your knees, swimming is a great activity that's low impact, but it's aerobic. It's going to build your strength and help with your cardiovascular fitness as well. Almost all Medicare Advantage plans and even some supplemental plans come with a wellness benefit. So you could get a free gym membership at a place like the YMCA or a lot of other gyms in your community. These are usually through Silver Sneakers or Renew Active. So this is great for you to take advantage of this because not only can you be part of a community, they have a lot of events at these centers and gyms, but you can also work on your fitness, your strength, and your cardiovascular health. Health danger number 3 is neglecting your mental health. 1 out of 10 older people suffer from depression. And the National Council on Aging reports that 20% of people over the age of 55 struggle with some kind of mental health disorder. So it's really good to just kind of do a mental health check. Really look at yourself, like, how am I? How am I doing? And it's interesting, at this age, as you approach Medicare and you turn 65 years old, some of you may be living your best life, right? Maybe you're very social, you're out there golfing, you're playing pickleball and cards with friends and doing a lot around other people. But maybe that's not your life right now. Maybe you've lost your spouse, or maybe you're divorced and you're single. Your children are probably grown and out of the house. So you may be feeling lonely. It may be easy to settle into the couch, zone out on your phone or Netflix, and really isolate yourself. So it's very important to check in with yourself on how you're doing and how your mental health is. Now, your mental health is important because obviously you want to thrive and be happy, but there's more of a link that is is actually connected to your physical health. There's been a lot of research that shows that people with higher levels of optimism and happiness actually are more likely to have exceptional longevity, which they consider living past the age of 85. So there's a big connection to your mental health and your physical health. Now, have you ever heard about blue zones? There's actually a documentary on this. And blue zones, these are pockets of places in the world where people live a lot longer. So these people have some things in common in these blue zones. First of all, they have a very high life expectancy. So they live longer than average. If you ever heard of a centenarian, that's someone who lives to be 100 years old. So a lot of these people live in blue zones. They also have a lower rate of chronic illness. So these people have less heart problems, diabetes, high blood pressure, all of those things that a lot of us suffer in the United States, especially. We see in these blue zones, there's a lower rate of these chronic illnesses. And then they really have a strong sense of community. When you look at this, there's a lot of talk about community, being part of a community. And these are just some things these people in blue zones have in common. So let's look at some of the things they do that may attribute to good mental health and longevity. So let's look at some of these things they do in the blue zones. So first of all, as we said, they have a very strong sense of community. So it's shown that being social, being around other people, and having your tribe really can help your mental health. So these people, you'll see they do things together, they work together, they eat together, and really have a strong sense of community in these areas. Next, they move naturally, okay? So they may not be going to the CrossFit classes or the gym, but they're very active. So they walk places, they're doing gardening and work outside. They're not sitting around or sedentary. Now they have a purpose. So as they age, they still have a purpose. What gets you out of bed in the morning, right? What kind of lights you up? What are you doing every day? So a lot of these people will volunteer. They're involved in mentorships or doing things to help children, just something that plugs into your passion, your values, and what's important to you. So it's very important to have a strong sense of purpose. Now, another one they call downshifting, and really this is just reducing stress. And we know here that stress is a huge impact on your physical health, right? As far as your blood pressure, cardiovascular issues. They've shown that stress can lead to a lot of these health problems. So these people make sure they do things like spend time in nature, walk outside, pray, meditate. They make sure they're very conscientious about reducing their stress levels. Now, also, they have a ritual that they call Friends at 5. We may call this happy hour in the United States, but really what it is just making sure at the end of the day, they're spending time with friends or family members. So maybe this is a meal together, or maybe it's having a cup of coffee or a cup of tea, and just having that time in a group and friends at the end of the day to kind of share how your day went, any stresses or troubles you have in life, and just have that strong sense of community. And then also having a positive pack. So you might have heard it said that you are like the people, the 3 or 5 people that you spend the most time with. Well, they've shown that things are contagious, like happiness and optimism. Also things like people, if you smoke or if you drink a lot or if you're, kind of negative, that can be very much spread, and that can be affected by the people that you spend the most time with. So in these blue zones, they think it's very important to have a positive pack and make sure you surround yourself with people who have an optimistic, happy outlook on life. So these are just some of the things that the people in the blue zone do that they said have contributed to their longevity and a happy, healthy life. So again, doing that little mental check-in with yourself. Are you doing these things? Are you spending time socially with friends, right? Are you around positive people? Maybe you're not working anymore, you're retired. What is your purpose in life? Are you volunteering or part of a church or a community center, something like that, that's going to give you a reason to get out of bed in the morning? So if you are having any problems with depression or mental health, there's ways you can proactively combat this, and you can use your Medicare plans to help that. So Medicare Part A and Part B are going to cover some things for you. Those are a psychiatric evaluation. So you can have a psychiatric evaluation. They're going to cover family or individual counseling if you do need to talk to someone. Also, they're going to cover and help with things like medication management management. Maybe counseling's not enough. Maybe you do need to go on a medication for your mental health issues. You can always have those covered through Medicare. And then again, psychiatric testing. If you're taking medications, there's tests out there to help them find what's the best medications for you, or if you've been on treatment, just mental evaluations to see if you're getting the help and the care that you need. So don't wait until you're feeling down or you're gloomy, like kind of keep a check on that. And if you need to, make sure you're using the services that are available to you that Medicare will cover to keep an eye on your mental health. Now, two key things in this, which we'll talk more about, is you get a welcome to Medicare visit. Now, this isn't really a physical as much as a preventative conversation with your doctor about your health care. So in this welcome to Medicare visit, they will do a review of your risk factors for depression. So you might say, well, what's a risk factor for depression? But they'll ask things like, hey, how's your overall happiness level? Do you live alone? Are you social? So just things like that. This welcome to Medicare visit, they will kind of assess where you are as far as your happiness and the joy you're having in life, and are you kind of susceptible to any mental health issues. And then also you'll get a yearly wellness visit. So every year, and it doesn't matter if you have that welcome to Medicare visit or not, that's not required every year to get the wellness visit. Maybe you didn't do your welcome to Medicare visit. That's okay. Every year you have another chance to do that wellness visit and have a preventative, kind of proactive conversation with your doctor about your mental health and your health overall. Now, if you do need to talk to a counselor or a psychiatrist or a therapist, remember that your plan, whether that be an Advantage plan or a supplemental plan, can help out. So usually I've looked at some plans that are Advantage plans. Depending on the plan you have, you're probably going to be able to go see, to do individual or group therapy sessions from anywhere from maybe a $25 to a $55 copay. Again, that depends on your plan, but there is assistance in getting help paying for those visits to talk to someone and for a therapist. Now, remember, a supplemental plan is going to pay anywhere that Medicare pays. So if you go to somebody, a psychiatrist, a counselor, a therapist, just make sure they accept Medicare. And if they do, you'll be able to use your supplemental plan. Health danger number 4 is poor nutrition or excessive alcohol use. Now, maybe you're an empty nester, the kids have left, and you're just not cooking regular meals or dinners like you used to. Or even worse, maybe you're skipping meals altogether or just hitting the drive-thru. You are what you eat. There's a saying for a reason. So it's really important as you age, you want to make sure you're eating a nutrient-dense, balanced diet full of protein, healthy carbs and fats, and fruits and vegetables. This is going to keep your activity levels up and help you stay healthy as you age. Are the happy hours getting a little too happy? Unfortunately, a lot of social things we do revolve around alcohol. But it's shown that excessive alcohol use, especially in seniors, can lead to faster cognitive decline and problems with thinking and memory, and even your judgment. These effects can negatively impact someone's quality of life. Excessive alcohol use can also precede or worsen mental health conditions. Maybe you're going through a stressful transition in life, like retirement, loss of a loved one, or even health issues. Well, these times can make you more prone to use or continue to misuse alcohol to deal and cope with feelings of loneliness, boredom, or anxiety. Also, older adults may take a lot of medications that don't mix well with alcohol. Adding alcohol to these medications would make the medications not effective and work the way they're supposed to, or even make them dangerous or deadly. For example, medications that are used to treat pain, depression, or sleep problems, when mixed with alcohol, could cause extreme sedation. This could increase your risk of falls, injuries, or overdoses when these medications are combined with alcohol. In older adults, alcohol consumption can exacerbate existing health conditions or even lead to new health conditions. There's been links shown that alcohol can increase your risk of diabetes, cardiovascular issues, memory loss, and even mental issues, increasing your risk of depression and suicide. So it's important that you follow the rule, everything in moderation. Now, how can Medicare help? So again, going back to nutrition and eating healthy, that wellness visit that you get every year with your doctor, you're going to talk about your nutrition and if you're eating a healthy diet. Now, there are things available to you, even nutritionists that could be covered or nutritional counseling if you need it. Specifically, if you have conditions like diabetes or kidney disease, the doctor can refer you and it will be covered by Medicare Part B for nutritional therapy if you need these services. So if you're not sure if you're indulging a little bit too much, Medicare Part B also offers alcohol misuse screenings that are available to you each year. If you and your doctor decide that you're misusing alcohol, you can get up to 4 brief face-to-face counseling sessions each calendar year. As long as that doctor accepts Medicare assignment, you'll pay nothing out of pocket. So again, it's never too late to start taking care of your health, and that's eating a nutritious diet and making sure you use moderation when it comes to happy hours. Health danger number 5 is neglecting preventative care. Hopefully you're at the age where you realize health is wealth and it's very important to take care of yourself. But maybe you're coming off of decades of taking care of other people, whether that be your kids or your grandkids or a spouse. And maybe you've spent decades in your 30s, 40s, and 50s grinding out long days in a career. Well, it's really important, and one of the most preventative things you can do is see your doctor regularly and take care of your health. So let's look at how Medicare can help you do that. First, there's the Medicare annual wellness visit that's covered by Medicare Part B. This is a conversation and a meeting where you and your doctor come up with a preventative, proactive health plan. This may include things like a cognitive assessment, review of risk factors, and a preventative screening schedule. Medicare also is going to cover preventative vaccines like the flu shot, COVID, pneumonia, shingles, or even the DTaP booster. Medicare will also cover preventative cancer screenings. So mammograms for females, especially age 50 to 74, should be performed each year. You can also check for colorectal cancer by proactively getting a colonoscopy every 10 years. And then for males, it's good to also have prostate cancer screenings, which you should discuss with your doctor. Some other screenings your doctor might perform are bone density tests, especially for women over age 65. And then eye and hearing tests, cardiovascular tests, and even pre-diabetic screening. And to make sure they're looking at you and your total well-being, they'll also discuss things like mental health screenings, just to check for depression or anxiety. They'll also talk about weight management and healthy nutrition, and also review your medications each year. So it's very important. You want to make sure that you stay on top of your preventive visits to the doctor, get these screenings and these vaccines so you can stay healthy. So now we've uncovered 5 major health risks for you as you get older, and hopefully you have some tips of how to prevent these things and stay healthy and independent as you age. I don't know about you, but with me, every day I wake up feels like a gift, and it's never too late to start investing in your health and taking care of yourself each and every day. Now, if you still need help talking about which Medicare plans would be best for you, schedule a call with one of our guides. It's always free to you. There's no charge. We'll talk to you about your unique situation and make sure we educate you to make decisions on which Medicare plan is going to be the best fit for you.